This video is related to important points for the topic osteology and cleft lip and palate. So both the topics are quite important, but again don't go very depth. Just know the classical features and at least the points which I am reading out here, you should have covered those. So osteology, first you should know what are the paired bones and what are the unpaired bone. That is an MCQ point. So at least the unpaired bone or the single bone, what are the single bones present in neurocranium, which is the one that covers the brain, and the viscerocranium, that is the skull bones in the facial region. So what are paired bones, what are unpaired bones, you should know. Then the formation of the bone which all undergoes endochondral ossification and which all undergo intramembranous ossification. So majority of the bones, they undergo intramembranous ossification, whereas these four bones they mainly undergo endochondral ossification, which you can remember by the mnemonic MOST: M for mandible, O for occipital bone, S for spinal bone, and T for temporal bone. And then just to brush up few anatomy from the frontal surface, at least you should know about the foramen: supraorbital foramen, infraorbital foramen, superior orbital fissure, and the mental protuberance attachment related to it, and zygomatic arch and the sutures. From the lateral side, you should know about pterion, asterion, the coronal suture, lambdoid suture, and then infratemporal fossa, the muscle attachment near the zygomatic arch, and the infratemporal fossa region itself, the anatomy related to it. A little bit you have to know. You have to be aware of some muscle attachments whichever is there near the infratemporal fossa region, because muscles of mastication gets attached there. So muscles of mastication attachments are very important. So masseter, temporalis, lateral pterygoid, medial pterygoid, the origin and insertion is very important. So any anatomical landmark related to origin and insertion of these four muscles are quite important. Then about the styloid process and mastoid process. Then from the posterior most, nothing much is important, so you can little bit skip this anatomical point. The cross section, both the cut cavity and the skull, it is very important. The base of the skull and the cut portion, the middle cranial cavity, is very important. All the foramens, if you remember, it is well and good, but at least, if not, at least you should remember in the frontal surface I've mentioned the superior orbital fissure, and then in the middle cranial fossa you should read about foramen rotundum, foramen lacerum, ovale, spinosum, jugular foramen, and the foramen magnum. Foramen magnum, at least the nerves passing through the foramen magnum is very important. Again at the skull base, the same foramens will be there. Foramen rotundum alone, it will exit through the pterygopalatine fossa. So that is why it is also called as magic foramen, and maxillary nerve comes out of it. So infratemporal fossa, as I have already mentioned, the muscle attachment is very important in the infratemporal fossa region. So muscles of mastication gets attached here and there. So you should know the origin and insertion of each. And then the pterygopalatine fossa, you should know the foramen rotundum exits in the pterygopalatine fossa. So in the middle cranial cavity, it is a foramen, but base of the skull, if you see, the foramen rotundum will not be there because it travels through and through and it opens into the pterygopalatine fossa. Then this part, if you are interested, you can go through, but otherwise if it is very confusing and anatomy is just not your subject, you can completely skip this image. Same way, the ethmoidal sinuses, all those drainage of the sinus, you can just skip it. This one table alone, if you could remember and read, is more than enough. The drainage of each sinus, where it drains. Sphenoidal sinus drains into sphenoethmoidal recess of nasal cavity, is quite important. And then the nasolacrimal apparatus drains into inferior meatus. That is second most important point. So important cranial foramen, these all are important foramen, of which the very important ones include optic canal, superior orbital fissure, foramen rotundum, ovale, spinosum, foramen lacerum, then foramen magnum. Mandibular foramen and mental foramen, obviously we know what passes through it, and it is obviously very important foramen. So these foramen, if you could remember, it is well and good. Next topic, cleft lip and palate. So cleft lip and palate, mainly you should read about development of face, development of palate, and then cleft lip palate classification. So under the classification, these two are important: View classification and Carnahan stepwise classification. So development of face, it is developed from 5 processes. So 1 frontonasal process, 2 maxillary and 2 mandibular process. So maxillary process, it is a forward growth of the dorsal end of the first pharyngeal arch, and mandibular process is a forward growth of ventral end of the first pharyngeal arch. So both the maxillary process and mandibular process itself develops from the first pharyngeal arch. That is an MCQ point. Then again, palate formation, how it happens. So two plate-like shelf medially extends from the maxillary process, that is called as a palatal process. So 3 components totally contribute: 2 palatal process, and the primitive palate is directly from the frontonasal process. So then the cleft lip palate classification. So one is a classical view classification, which consists of 4 groups. Then you have the easy one, which is usually used during surgical purposes, because you have hard palate, soft palate, and primary palate differentiation in it, and this is called as Carnahan stepwise classification. So these are the basic things which you should have must covered from the cleft lip and palate topic. Thank you.